Greetings, everyone, and welcome to the post-show conversation for 76 Days here at the Boston Asian American Film Festival, where we're featuring it as our centerpiece documentary. My name is Susan Chinson, the festival director here and the creative producer at Arts Emerson. Speaking to you today from the unceded lands of the Wampanoag, Nipmuc, and Massachusetts tribal nations. We are all here today under such great and extreme circumstances. About 4 months ago, we never would have even dreamed that we were going to be able to have the festival. And here we are today, gathered together in a virtual setting. We really hope under this year's theme, Rising Together, that you're able to enjoy a number of films that still help you find ways to connect with community and humanity and connections with one another. This film in particular, 76 Days, provides so much of that. Looking at today's world in which we are living in, even here in Boston, there's so many themes that resonate. As we were screening the film internally, we recognized how much of the hope we needed to see in this film. And we were so delighted to be able to be hosting this conversation today. Joining us today to help us moderate the conversation is the talented and gifted Callie Crossley, who is the host of GBH's Under the Radar series. I'd like to welcome Callie with us, and thank you so much for joining us, Callie, and I'll turn it over to you.
Oh, I'm delighted to be here. Thank you so much for inviting me. What a beautiful film, lot to talk about tonight. Let me introduce our guest. First of all, the director, Hao Wu. He's one of 3 directors actually, but he's here with us. And our other guest is Rakhi Teena doctor. She is an attending physician in the Division of Infectious Diseases and Geographic Medicine at Tufts Medical Center and assistant professor of medicine at Tufts University School of Medicine. So first, congratulations, Hao Wu. You just got the AFI Audience Award, a top award. That's fabulous. You're on a roll.
Thank you. Yeah, it just it came as a complete surprise because I didn't even know AFI Fest was giving out awards like this, so wasn't expecting it.
Well, you got that one earlier in the month. You got the Heartland Award, so I believe the talent is being recognized. It's a great film, so I wanted to make sure people knew that not just me thought it was great, but other people do too.
Thank you. Yeah, I'm glad to be here to talk to the audiences.
So very serious film. There are many ways to have gone at trying to tell this story. Yours is so intimate that I believe therein lies the power. How did you decide to make the film to just be so close in to the people in those hospital settings?
Yeah, I started researching this film in early February when a US network actually approached me, asked me if I wanted to do a film about coronavirus. So that's how I started researching, but then later on the network project fell through, but I continue. And the beginning was really confusing because when I was researching early February, it was still primarily China with some spillover in Asian countries, right? There was the Diamond Princess Cruise story, and then gradually there's a South Korea story. So for a long time, I was just struggling trying to keep up with the news. While at the same time, I was reaching out to filmmakers who had started filming on the ground. But then as soon as I saw 2 filmmakers' footage, who eventually became my co-directors, I was shaken because so up until then, mostly I only read about the stories in traditional news media about what's happening in Wuhan, how many people are dying. But then once I saw the footage, I realized how immediate, how raw the footage, how much emotional power this footage has. So then we started having very in-depth conversation. But still, for a long time, I wasn't sure whether I was making just a China story, a Wuhan story, or a story of 2 cities, because I live in New York City. I started filming in New York in late March as the pandemic hits New York as well. So maybe I was doing a tale of 2 cities, or even doing a global story because I reached out to people in Madrid and filmmakers in Madrid, in Italy, in Milan, and in Iran as well. But after I struggle around with exploring all these possibilities, then I reminded myself film is different from news reporting, because the more we appeal to humans' emotions, I think that's a unique power of filmmaking. So that's why I decided just go after my best footage, which is from the inside the hospital in Wuhan.
So how did you get the footage? One of your co-directors is anonymous, I assume for safety reasons, but somebody had to be right. They felt like they were right walking in the footsteps of everybody there, both the patients and the doctors. So please bring us into how that was gathered.
Yeah, so during the lockdown, China controlled access to the hospital. Only patients, medical professionals, as well as reporters slash government-approved filming crew could go in there. So my two co-directors, one of them, Weixi Chen, he's a video reporter for Esquire, China. So but then he wasn't sent over there to make film. He was just like, as soon as he heard about this lockdown, he felt like the obligation to be there to find out what's going on, to document what's happening, because he had a strong motivation to become a documentary filmmaker himself. He's made several shorts before. So he through his own personal connection, he found a medical team that was being sent from elsewhere in China to Wuhan to support the local hospitals. So he embedded himself with the medical team. And as long as, as soon as, basically once he arrived in Wuhan, the local hospital who was hosting this medical team, the chief agreed to let him film. And because he's a reporter, he has a reporter's ID, and then he was allowed to just roam for free in the hospital. And my other co-director who's remaining anonymous, he's a photojournalist for a very local state-owned publication. And he obviously was sent there on assignment, but he started making videos because he felt like with photos alone, it was really hard to capture the intensity of what's happening on the ground. But with him, because he's always working the state system, he's afraid of any potential backlash. Depends on how I edit the film, that may affect his livelihood, affect his job. So he's chosen to remain anonymous.
Okay. Doctor, I want to bring you in because the first thing that caught my eye being in this country and having every day heard about the necessity of PPE was how much PPE the doctors had on. I mean, there was no exposure. I was just blown away by that because we went through a period of time where there was a shortage and I didn't see people in that kind of protective gear. So I wondered your impression. I also was struck by when it began in January 23rd, the doctors appeared to have more information at that point about how to respond than we seemed to get until much later.
Yeah, I agree with you. I think looking at they're fully covered head to toe, and it appears that the PPE was readily available, and it didn't seem to be that they were conserving it whenever we saw footage where they were taking it on, taking it off. I'm fortunate where I practice, we didn't have a PPE shortage. I felt comfortable. There was enough PPE for all of us. I know that wasn't felt universally throughout the country. So that kind of was a stark contrast. I agree with you.
And what about how much they knew in January or appeared to know? I was taken with, as they're interacting with the patients, no, don't do this, don't do that. It seemed to me a great amount of knowledge about, even at that point when they didn't know everything, nobody could have at that point, how the virus is going to work.
Yeah. I mean, they seem to be extreme, like taking appropriately so extreme precaution, wiping everything down, very much disinfecting, separating people from their family. I think the other thing that struck me is they didn't allow patients to go home. Even if they were feeling better, it sounded like in the movie, maybe they had to have a certain number of negative tests to go home. Maybe they had to meet a certain number of days to go home, et cetera. So they're just rightfully so very, very cautious.
Now, sorry to interrupt. I think it's actually China's going the other extreme, right? After you've gone, you have to be testing several times negative, the PCR test, and then you'll be sent to a quarantine site, either a hotel or a special quarantine site for 2 more weeks, undergoing several rounds of tests before you will be released back home. Even once you get back home, the government really still continue to follow up with you to make sure you don't have any relapse. You don't become positive again. So I think in China, the approach is very different from the approach we have here. Whereas the Chinese government basically doesn't trust you be doing a good enough job. They really have to monitor you thoroughly to make sure you don't infect anybody around you.
Well, that was the story with the parents of little Penguin. They had to be quarantined before and separated from the baby before they could get the baby back. So that there was that demonstrated. One quick question from you, doctor. What particularly struck you from your perspective as a physician? I'm overwhelmed with the emotion of the film and the intimacy of it. I wonder from your perspective, what struck you?
You know, there are so many emotional very powerful emotional moments in this film. So it's hard to focus on one. You know, I think one theme that recurred in the movie that I think resonates with many of us here is loneliness, isolation. I think we saw it in the healthcare workers, we saw it in the patients, family members at home, you know, at some moments a feeling of helplessness. You know, when you brought up the moment of little Penguin and her parents, I mean, throughout the movie, when I saw that baby, I'm agreeing with the nurses when they're caring for her. It's just totally an adorable baby. And then we sort of learn, okay, the mom had it, they're at home. And then the parents are really getting ready for the baby and just kind of hanging on to the every word. When is the baby coming? Even at that final moment, so many emotional moments. And it was a very happy union, you know, once the baby came home.
Hao Wu, I really appreciated the along with the doctor, the intimate moments with the nursing staff and what we've heard and know, because we know how nursing staff and actually all the frontline workers in the hospital have been with patients, of all their patients, but COVID particularly, the care, the tenderness of the staff members. Did you know when you started looking through the footage that was going to be so predominant in your film? Because that just really got to me.
That's very interesting. I think any different director or filmmaker will make different film, even with the same amount of footage, right? So for me, this film has been really personal in the sense, like, originally I had planned to take my kids back home for Chinese New Year on January 23rd, the day Wuhan was put under lockdown, but I couldn't because once we heard it was under lockdown, so I decided to flew to China by myself without my kids. Both my parents had, you know, late stage cancer and they had surgery. So I was trying to make sure they can spend whatever little time they had left with my kid, with their grandchildren. And then really quickly in early February, my grandpa was diagnosed with late stage liver cancer. He passed away in early March and I couldn't see him because China, US started restricting air travel between the two. And then I wasn't fully prepared for how fast he passed away. So when I was looking through this footage, because the story had become so personal, I have a lot of personal emotion. And then what touched me was those moments of human connection. Like Dr. Teena said, the loneliness, the isolation, but at the same time, we all try to reach out, try to connect. So because I feel extremely guilty on not being able to say goodbye to my grandpa, so whenever I see those moments, that stay with me. So maybe that's why, even subconsciously, I was emotionally responding to images and scenes like that. So when I started editing, I naturally pull those scenes out, you know, and give them much more prominence, maybe than what some other filmmakers would have chosen to do.
So how do you feel about it now? I mean, when you got to the end, I don't know how, because you have to process all the emotion while you're doing it. And the end just about took me out. I mean, really, I just was, yeah, that was a lot. It was I really felt that with the ICU worker calling people. How did you feel at the end? Did you feel like you said everything you wanted to say about this in this moment?
I think I emotionally, it's like, for me, making a film is like singing a song, right? A song is never complete, it's never comprehensive, can never say everything you want to say, but it conveys an emotion And hopefully that emotion will be able to move the listeners or viewers. I think for that, I definitely achieved my goal. I feel like it's resonating everywhere. People get to see it's not a China or Wuhan specific story. It is a story, about our common human condition living through a natural catastrophe. So I feel very happy about it because I firmly believe, even though a lot of my American friends say, how come the Chinese hospital, they're handling it so well? I'm like, I have firm faith that we are doing the same thing here in the US, just like what people are struggling to do in Madrid, in Italy, everywhere. I think that's, despite how horrible this pandemic has been, how politically divided we are, I still have faith in our human kindness to help each other through this.
So what do you think about what's become a huge political context with our president saying, well, we wouldn't have had it if it hadn't been for China. They, somehow deliberately sent it to us, blah, blah, blah. Because this film gives you a whole other perspective about what was going on. Well, it gives you the only perspective I think a lot of people will have about what was going on the ground there. So people have in their minds what was happening, but just to see it is really quite eye-opening. And I wonder how you felt about the political context now in which this film will be seen.
It's a tough one. I think at the beginning, when I heard about the lockdown, I think the entire country of China was confused and angry. It was like, why did it become so big, so out of control? I was angry too. So one of my initial intention when I first started researching this project was to do an investigative piece to find out what really happened at the very beginning. But really quickly, a couple things happened. First of all, I realized I could not get really good, like groundbreaking investigative footage to review anything new that the news media haven't already covered. And secondly, because this pandemic is still happening, still evolving, it's really hard to say who did what wrong or right. And thirdly, I spent a lot of time reading about past pandemics throughout the history, right? The AIDS pandemic and Spanish flu, the Black Death. It just dawned on me that every single time something like that happens, we always want to blame other people. We have the tendency to blame others. So that's made me gradually wanting to go away from like trying to analyze the situation, trying to assign blame, because we're still living through this. So right now, my intention is that trying to highlight how similar we all are and trying to remind us that we all have to help each other to survive this. Because I don't think it's not a time to even do that blame game yet. I mean, let's survive this together first, and then we can go look back and try to analyze what could have been done right, better.
Mm-hmm. Doctor, what do you want people to take away from a health perspective? What do you want them to see in this film that might make them think? Because we're still, Hao Wu is correct, we are still struggling over here with people just accepting the fact that this is a very serious disease.
Yeah, I would like people to see that this is serious. This is highly contagious. Looking at the movie, a number of people in the same family were sick. And in this movie, you can see slowly things get better over the course of 76 days. And I think during those moments, the hospitals, as Hao pointed out, were very strict in releasing patients. Clearly, everyone's wearing a mask, washing hands. That was emphasized throughout the whole movie. I think this movie shows how seriously this virus was taken, how aggressively it was managed and treated. And then after the 2.5 months, slowly things were getting better. And it's human nature. Even in the movie, you can see people were very excited. Oh, great, I'm out of lockdown. I love the scene of someone getting the haircut outside. I think all of us felt that after several months of lockdown. It's nice to be outside, or, oh, I can get my haircut again. But everyone, there definitely seemed to be a level of doing your part, being responsible, and not just immediately going back to normal right after the lockdown. And I hope that that resonates with people here, the importance of that, especially as we approach potentially more difficult times ahead.
So let me ask you the same question. What would you like viewers to take away from this? You've done a number of films, but this is quite different. As you said, it's not an investigative piece, but yet actually it is, because when we look back, even in a short period from now, yours is going to stand as one of the few films on the ground during very critical times.
Yeah, I think just like Dr. Teena said, I think one of my goals is that to give visual evidence to how serious this virus is, because I think in this country, the discussion of COVID has become more about statistics, about politics. We haven't seen enough frontline evidence how much damage this virus can do to individuals and to families. So my personal hope is that people can watch the film and really realize I need to take this seriously. Mm-hmm. And also, another thing I'm still struggling with within myself in terms of the very strict measure China implemented to not, okay, obviously my film only shows one aspect, which is the frontline hospitals, but hopefully there'll be more film coming out about Wuhan where that people can learn about how the government really try to manage at a neighborhood level to control movement. A lot of people sacrifice a lot of personal freedom to comply with the government's rules. So that's part of the reason the Chinese government can quickly bring the virus under control. Whereas we're not seeing any of that here, right? Here is all voluntary. If you feel fed up, you can go out. Nobody's gonna stop you. So I think that this film can make people start thinking more about that. So in terms of as a community, we're trying to survive the pandemic, how much personal freedom we're willing to give up, how much we're willing to listen to science and the government's directions in order to work together, because it's a public health crisis, right? Yeah. How we can work as a community to quickly put the virus under control. So that's one thing I would like to see more.
Okay, we have some questions from viewers. Did the Chinese government ask to review the film before you could release it to international audiences?
No, this film has been a complete, okay. So first of all, my two co-directors work on their own time. And then how shall I say, the people tend to think the government controls everything. China is a very large country. Yeah, Chinese government does attempt to control a lot of things. But then the matter is that it's a very big country. Things get slipped through. And then, my co-director uploaded the footage onto the cloud. I downloaded them in New York. I was editing in secret. I didn't tell anyone all the way up to July when we submitted the film to Toronto Film Festival. So we didn't raise any money before then. We're just working on our own time. So China doesn't even know until the film premiered at Toronto.
Okay. How did you find or pick the patients to follow, for example, like the grandfather with dementia and the family with the baby?
I think most of the credit, I need to give most of the credit to my co-directors, because even though they've been uploading the footage onto the cloud, I will review it, I'll have a conversation with them. But in the hospital, it was so chaotic. As a filmmaker, it's really hard to know which character I should focus, and whether maybe this character's condition will get worse or get better and gets released the next day. You have no idea. A lot of things are happening in the hospital. I think a lot of it, but obviously the grandpa was such a character. So my co-director Weixi Chen and also because he was not that sick, right? He's not that sick. So it's much easier for my co-director Weixi to shadow him everywhere. But with the other characters, even though some of them you feel like they appear throughout the film, it's actually not, because my co-directors, they shot maybe, just the character maybe at most 4 times or 3 times, 4 times, but it's through editing. I try to pace the story to make them feel like they are recurring more, because it's really hard to know before we started editing which character story is more interesting. But there are certain characters like the young baby, right? No doubt. I encourage my co-director Anonymous that film as much as you can, because this is a story about life and death. That's life there, right? That's a new life. So definitely follow it through.
Plus, it's very, very cute baby, if I may say. Dr. Teena, how does the experience compare to an American hospital?
Yeah, well, I think this movie actually highlights a lot of similarities. And I think it really shows how this experience, as Hao was saying, as he wanted, it really brings us all together. I think we're all kind of trying to overcome, the same hurdle. We all have the same goal. So, I think there are many similarities. I think one thing that kind of struck me, how it's very difficult to be in the hospital and not have your family there, not have your loved one there. The poor woman giving birth to little Penguin, is asking, can my husband be with me? Like, I don't think he's sick. And, he's fine. And, sort of then being alone and people FaceTiming. That was common now, even now in the hospital, bringing a visitor is very restricted. So I think that experience is really universal, and it's hard on everyone when you're sick, especially life-threatening illness, and you can't have your loved one there.
And what about I thought it was very meaningful to see the fatigue of the frontline healthcare workers. I mean, we hear about it here, but to see them, right at the beginning of the film when they said, no, this bench is for us to sit and rest. We're going to need to sit and rest. And you really have a sense of what they're up against, every day.
Yeah. The beginning of the movie was so powerful. It was, I think, a healthcare worker witnessing, if I followed it correctly, the passing of her father. I mean, how that was a very emotional scene. Yes, you can see it, how hard this was on healthcare workers. At the same time, I agree, this has been mentioned before, how empathetic they were, how they really treated each patient like their own family. I really liked how they referred to, the elderly man as grandpa, and then grandma, and even the young couple referring to the nurse in the ICU as auntie. And I'm sure a lot of that is, just a cultural influence, but it was very moving. And also, similarly, it goes both ways. I think patients were very appreciative of the work that the healthcare workers were doing.
Hao Wu, you wanted to add something?
Yeah, I mean, I think like I said earlier, I firmly believe the relationship between medical workers and patients during COVID should be the same. And I know several American filmmakers have been able to get access in hospitals. I'm really, really looking forward to their films. I feel like my instinct is that it's going to be similar. It's going to be talking about similar themes. But I actually have a question for Dr. Teena, because at the beginning, back in March and April, we heard so many horror stories in news media about what the hospitals are going through. Do you think those reportings were unique in the sense that they're probably reporting from the worst hit hospitals in the US, or were their stories representative?
Yeah, I think certainly in the beginning, in March, April, there were hot spots, and I think hospitals in those hotspots certainly reached capacity very quickly. And I think, it was very difficult in those areas. I don't think, unfortunately, it wasn't just a smooth, steady influx of patients universally. It wasn't really spread out evenly. I think densely populated cities were hit harder than areas that are more where people live in a more spread out geography. So yeah, I definitely could see some similarities here in this movie. At the beginning, you could see the lines of patients just kind of waiting to get in, and the poor healthcare staff saying, where do I put these patients? I have 50 outside, I have 5 rooms. The math just doesn't add up. What do you do? And, certainly I think that we were seeing that in hotspots in the spring here, particularly in New York City. But fortunately, I'm in Boston. I think we didn't have that degree of being over capacity. So thankfully, I felt more in control and sort of more able to care for patients.
How are you? What kind of response are you getting to the film? I know it's not out to everybody, but as it's going to the festivals and more people are seeing it, I'm curious about the kind of response you're getting.
So far, I've only been to virtual festivals. So unlike a physical film festival, I haven't been able to really meet audiences in person. So all I can monitor is people talking on Twitter, and those people who talk on Twitter tend to be film critics. So I don't know whether they're critics and reporters. So I really don't know whether they really represent the average viewer's experience. But it did come back to me, like I mentioned earlier, several people mentioned to me, say, oh, China is so well organized in this. That really shocked me, because for me, when I started editing this film, I thought I was focusing on so much of the chaos and fear and desperation. But then somehow it came across as China being, but granted, because China was really paying attention to this, right? Taking this really seriously. So once the government really decided to take firm control, the chaos was quickly put under control. So, but then it still shocked me, why do Americans tend to think situation here are absolutely dire? So that's why I'm asking Dr. Teena, was that, is it just because media, all the story we've heard here is about how we felt at the very beginning? We haven't talked enough about how we are handling this. So that's something I want to find out more. So I'm waiting to.
Well, there's upticks everywhere now. I mean, all across, as you know, the Boston mayor, maybe you don't know, just said the schools cannot open. The schools were supposed to open, and he said, no, we're going to be remote because the cases have ticked up again. And we had been out of the orange high risk category. So there's real concern about people either being lax or more spread. Probably Doctor can speak to that, because people are, the schools are open and kids are back in college and there's just more interaction.
Sorry, I meant what confused me, what intrigued me was when people were commenting on, oh, the Chinese medical workers treat their patients so nicely. That's not what we heard. What we heard that what's happening in American hospital. I'm like, you must be kidding me. I have
no. We have many stories of the frontline workers and how kind they've been, particularly holding up the phones and making sure people could see folk. They did everything that I've heard. Dr. Teena, have you weigh in? I've never heard nothing but good stuff about them.
Yeah, no, and I was feeling lots of love March and April as a healthcare worker. I think people were very appreciative of all the work that healthcare workers were doing. I mean, so many hospitals received food donations for healthcare workers. In New York City, there was a clapping ceremony every night at 7 p.m. In Boston as well. So, I think it was a time of great camaraderie as healthcare workers. And I think that was evident in this film also, people really working as a team. It was a very memorable time, and I feel that patients appreciated the work as well.
Absolutely.
Well, thank you very much for joining us, Dr. Rakhi Teena Kohli, who is an attending physician in the Division of Infectious Diseases and Geographic Medicine at Tufts Medical Center, and assistant professor of medicine at Tufts University School of Medicine, and of course, our director, Hao Wu. What a fabulous film. I mean, a horrible subject, but you just did it so well. So congratulations to you. Now, you please cast your audience ballot by clicking on the button on the bottom of your screen. Visit BAAFF BAAFF.org to view the whole lineup, hashtag BAAFF 2020. Stay safe and healthy, and good night. Thank you all.
Thank you.
Thank you.
Good night.
Good night.